When it comes to enhancing the way we collaborate to promote a more equitable global economy, as economists, we can be far more intentional about seeking views outside of our own discipline. Part of my work at the International Monetary Fund is to identify emergent risks and evaluate their impact on our member countries. When COVID-19 began spreading, we quickly realized that we needed to hear from and learn from epidemiologists, virologists, and other public health experts to better understand the fundamental characteristics of this pandemic. How far would it spread? How would it affect different populations? How long is immunity likely to last for? And on their end, they found our still developing economic frameworks for assessing the impact of the pandemic to be quite useful. And this cannot be a one-off collaboration. We now participate in weekly calls with public health experts all around the world. It's built into our strategy. But the response to the pandemic highlights just one example of how we are better off when we collaborate across disciplines. More broadly, as economists, our analytical frameworks, and more importantly, our policy guidance, would also benefit from greater sustained engagement with sociologists, historians, political scientists, and many, many other disciplines. Another COVID-catalyzed example of enhanced collaboration has been in vaccine development. There are now scores of vaccines in preclinical and clinical evaluation stages. However, there's only a select number of countries capable of mass production. We know that this virus does not respect borders, nor should our fight to stamp it out. This is exactly the moment for enhanced global cooperation, and effective vaccines, as well as treatments, should be viewed as global goods. The manufacturing and supply chain complexities of reaching vulnerable populations and new outbreaks in a timely manner will demand a Herculean collective effort. Also, with so many countries reliant on a recovering global demand and widespread removal of travel restrictions, much can be gained by promoting an equitable distribution process. Not to mention the higher costs that most countries will likely face if they try to go this alone. A really great example of enhanced collaboration in this space is the COVAX facility. This is a global pooled procurement mechanism led by the World Health Organization, Gavi, and the Coalition for Epidemic Preparedness and Innovation. The pandemic has also amplified pre-existing inequities, cleaving along socioeconomic lines and reminding us of the need to help vulnerable populations build resiliency to shocks and structural adjustments. If carefully navigated with close attention to inequities, collaboration in distributing COVID-19 treatments and vaccines could reignite global cooperation in other spheres like climate change and trade. Certainly, globalization should not look the way that it did in prior eras. It needs to look far better, and that includes being greener and more inclusive.